Hello, I'm Dr. Keith Lynch, and we're going to explain how we do our full spine adjusting program. In a different video, I explain how we adjust the very top bone in the neck called the Atlas Orthogonal Chiropractic Adjusting Instrument and Technique. In this video, we're going to talk about how we adjust the whole spine here. And we do that with a chiropractic adjusting instrument. So all of our adjustments are made without any twisting, popping, or cracking. So that means that they're done within the body's normal range of motion, and that's why you don't hear any noise. Just like if I were to take my finger and move it like this, you don't hear any noise. But if I took it and bent it over to the side, taking it past its normal range of motion, you're going to hear that gas inside that synovial capsule get compressed out of it, just like if you were opening a can of soda. And that's the difference between a manipulation and a chiropractic adjustment done within its normal range of motion. Both of them are effective. I like our style of adjustment because I believe it gives less stress on the joints that are being adjusted, making them last longer and work better. So what I'd like to do is, with my assistant Pete here, I'm going to demonstrate how we make that chiropractic adjustment. This instrument here looks just like a jackhammer, sounds like a woodpecker. I can control the amount of force that's made with it, and I'm going to have you just sit facing this wall right here, lower your chin just slightly. I'm going to hold the body still, and I'm going to apply this force right here to the spine, and we're going to gently bump that hard bone off of that soft nerve. Just like that. Now, as we're making that adjustment, we're also restoring that cervical curvature in the spine, helping to release the pressure on those nerves. I also have this attachment for the instrument here, so that if we have a vertebra that's rotated, I can turn the patient's head to one side, get right on that vertebra, and gently tap it right back into place. Now, this is also the instrument that we use when we're correcting a disc misalignment. So now when a disc is out of position, what you need to understand is that's going to cause pain and weakness and numbness and tingling down into the arm and hand, or it can cause that down into the legs, depending on where the misalignment is. If it's a cervical disc misalignment and it's a disc out at C5 in the neck, that's going to go to your axillary nerve, which goes to the deltoid muscle. You'll have weakness right up here in the arm, and we'll be able to test that both before and after the adjustment. If the adjustments that you're getting are only being done by hand, you can't get to the disc from that area. There's these bony locks and protuberances coming off the spine that kind of protect it from the back. To get to the disc itself, you have to come in from this front to actually bump that disc off of that nerve. Once that's done, you can immediately see the strength coming back to that deltoid muscle through that axillary nerve. That's how we make our corrections with the chiropractic adjusting instrument. Now, as we're adjusting the spine and removing those misalignments, putting pressure on the nerves, we also have to understand that there's more than one area where the nerve can get pressed on, not only from the vertebra or from the disc, but from scar tissue out in the rest of the body. For those corrections, I use this instrument here. It's called a percussion instrument, and the way it works is there's an actual motor in here that moves this piece up and down, sending a force wave into the body. And when we put this over areas of entrapment on the spine, like in through the shoulder, and then down in the arm and the forearm, we can relieve fascia adhesions that are pressing on nerves going out to the arms and hands, as well as down in the lower half of the body and out to the extremities. That's part of our structural program as far as releasing those nerves, so that not only do they exit the spine properly, but they make it all the way down to their endpoints without any interference to transmission. One more thing that we do during our structural adjustments is we use what's called cold laser. This instrument right here is our cold laser instrument, and you can see these red lines that are coming off of this instrument. This is actually a pulsed laser right here that you're seeing up on the wall. By applying this over the spine, we can actually affect how those nerves work. Now, they did a study at the University of Colorado, and what they found was that when there's pressure on a nerve, basically the weight of a dime or 10 millimeters of mercury, it's going to decrease the function of that nerve. And the way they did this test is they did what's called a nerve conduction velocity test. So basically, they put the weight of that dime on the nerve and then took it off. They applied a needle into the top of the nerve and then needle down at the base end of that nerve, and they gave it a light shock or stimulus. And then after they put the pressure on the nerve, they did that again. They found that it took 97 days after there was pressure on that nerve before that nerve actually worked properly again. By applying cold laser over that nerve root, we increase the amount of ATP available to those nerves so they heal faster by 7 times. What that means is when somebody comes in with a neck or shoulder problem and it's actually already created weakness in those muscles, by applying that cold laser over that nerve root, we're going to see that strength return, and we're not going to have to wait 97 days. We see it happen pretty much immediately right after the treatment. Those are the types of results we get with our structural program, and once again, we do all of this without any twisting, popping, or cracking. We look forward to helping you.